We turn now to the devastating effects of COVID-19 on people suffering from Alzheimer's disease and dementia. Many live in U.S. nursing homes and long-term care facilities where the COVID death toll now tops 100,000, according to a new tally by the Wall Street Journal. And for this vulnerable population, isolation from loved ones is an added risk. ABC's Elwin Lopez has this report.
We met on a blind date, a blind lunch, and had a long courting, I would say, back and forth for years, yet we knew we were right for each other.
It was a second chance they never thought they'd get. Both Dan and Denise were divorced and in their 40s, with children involved, but they finally took a leap of faith and married in 2003.
It wasn't too long after that, really, in about 2010, that we started noticing things going wrong with Denise, memory issues, getting lost, little things, and that just didn't seem right.
After 2 years of back and forth doctor visits, a diagnosis neither of them expected. Denise, at just 56 years old, had early onset Alzheimer's.
Hi friends, this is my video blog about Alzheimer's disease. And today is the day that we had to drop Denise off to a memory care facility.
Dan documented the ups and downs for nearly a decade. Their perilous journey now on YouTube.
Tell us a little bit, maybe how you're feeling about Alzheimer's right now.
If people, keep asking me questions, I'll probably tell them to go sniff a boot, but...
Early on, it was that sort of humor that carried them through.
That's how we get through this, isn't it? Just keep laughing, right? You're talking to the camera.
Okay.
Lean back.
I know. So long, farewell, la vida, say goodbye.
When the pandemic hit, silence engulfed the Gerkes and millions of others. Nursing home and care facilities closed their doors, halting in-person visits to protect those at high risk for COVID-19, including now 64-year-old Denise.
We did window visits. It was very, very difficult to do those because she would reach out. She would reach her hand out toward me, trying to touch me. And she couldn't.
A front row seat to a nightmare, separated from his wife of 16 years as he helplessly watched her waste away.
She lost about 18 pounds in less than 2 months. She looked ashen gray. She pretty much stopped talking and stopped interacting.
People with dementia and especially Alzheimer's disease can absolutely be affected by being isolated. It's essential to protect someone from getting the virus, of course, but there are downstream effects.
Less than 1% of the U.S. lives in long-term care facilities, but they account for about 40% of all COVID-19 deaths in the country.
We got a letter late April that the facility she was in was going to close down due to COVID. That was the single most stressful 2 weeks of my life, because here we are in the middle of a pandemic, okay, trying to find a facility that will take Denise was just excruciatingly difficult.
After a relentless search, Dan landed on a care facility willing to welcome his wife.
This has been the biggest leap of faith in my life. I didn't know anybody in here. I couldn't go in like I normally would, meet with Denise every day, feed her lunch, talk to the caregivers, get to know them, and explain to them who Denise is.
Hey.
Hey.
Okay.
From window visits to standing 6 feet apart, clutching her husband's hand, her one way to communicate, no longer an option.
And I know it's hard that you can't come in and touch her or...
That's been the worst, Ophelia. It's just been so tough, I just want to hold her hands, and that's why I want to, figure out how to change that. So, like I said, I'll put on a hazmat suit, gloves, whatever it takes.
People with dementia are not only dying from the virus. Since February, deaths from dementia across America are ticking upward, 35,000 more than expected when compared to previous years.
We're seeing Family members are talking about the decline that's happening. And we also know that there's been increased deaths, not necessarily related to COVID, but perhaps related to the social isolation.
The Alzheimer's Association urging state and federal lawmakers to provide rapid COVID-19 testing for staff, residents, and visitors.
And we've been able to figure this out in the NBA, in college football, hockey, you name it. There is a way to figure this out, but we've left the most vulnerable citizens without access to that level of testing. And it is really inexcusable. If we had a testing plan, if we had that set up, and the federal and state governments could support those resources, it wouldn't have to be like this. And we're 8 months in, and we still don't have a plan.
Are you cold? Are you okay? Denise? It's a double-edged sword in that the caregivers can't touch them because I want them to touch her. I want her to have that interaction, yet it's frustrating that I can't. The caregivers can go home, hug their spouses, hug their kids who have been in school somewhere else all day, increasing the risk of catching the virus, and then come back the next day and hug Denise, hold her hand, feed her. And here I am basically quarantining myself in my house, and I can't hold my wife's hand.
Not even with COVID testing, not even with gloves on?
Nope. I have to stay 6 feet away from her. I could have a stack of 1,000 negative test results, wear a mask and walk in there, and I still cannot get closer than 6 feet to Denise.
Are there any exceptions to that rule?
There are what are called compassionate care exceptions or end-of-life exceptions. If she is nearing, or anyone in the facility is nearing end of life, and we know it's there, and you've met the regulations, you can go in and hold their hand and be there with them at the end.
Now, as he once did in his 40s when he met Denise, he's clinging on to one last chance. This time, the chance to hold his wife before it's too late.
It would be so tough to look back and say, the only time in the last few months that I got to touch her hand was when she passed away. But that's a very real possibility right now, unless we change something.
Elwin Lopez, ABC News, Atlanta.
Another heartbreaking aspect to all of the COVID fallout. Our thanks to Elwin for that story.